Okay, so what we're proposing is for the under 65 population that we take the healthcare exclusion that exists right now, which is projected to be about $3.5 trillion over the next 10 years, and take the Medicaid portion that goes for able-bodied individuals. That's another $1 trillion when you add DISH and S-chip into it. That's $4.5 trillion over the next 10 years. The federal government is projected to spend just for people for healthcare under the age of 65. 2.5 times what other industrialized countries spend on their people on a per capita basis. And yet the system we have today, it leaves a lot of people uninsured. It leaves healthcare prices growing at unsustainable rates. We say let's take that money and give it to people in the form of vouchers or refundable tax credits to go purchase health insurance. But that's not enough. Not simply equalizing the tax treatment of healthcare and spreading it around to individuals. $5,000 for families and $2,500 for individuals is what we propose. But we also propose many other reforms. Insurance reforms like interstate shopping. Let individuals and families buy their health insurance in different states. So if you're trapped in a really high-cost state, you can buy an affordable plan that meets your needs, that you can customize your coverage in another state. We also allow people in small businesses to bulk buy their health insurance through buying pools on the ERISA platform. These are private buying pools, like through an association health plan or something like that. I also propose another a very important component to this, which is what do you do about the person with pre-existing conditions, the person with a catastrophic illness? Many ideas from the left say let's just have guaranteed issue or community rating or an exchange or a mandate. All of those things I think are needlessly complicated, restrict choice, and remove innovation from the marketplace. I believe high-risk pools are the way to go. So we propose setting up high-risk pools in each state, not a federal high-risk pool system, but a state-by-state high-risk pool system whereby a person with a pre-existing condition can get affordable health care. You do two things. You help that person get care that they need at an affordable rate, private plan. You prevent them from going into bankruptcy. You incentivize disease management, chronic disease prevention, and things like that. But what you also do is you actuarially improve the health and the price of healthcare for everybody else in America. And you have a much more vibrant individual market for healthcare in America. The other thing we propose is transparency. And rather than having the federal government design all these metrics for transparency on price, on quality, on best practices, which I think would be a dangerous precedent of having literally the federal government tell doctors how to practice medicine, I propose setting up a non-profit, public-private venture like FASB is for accounting, but for healthcare, so that you have this entity, and you can go through our plan to see exactly how we propose this, but you have an entity of all the stakeholders designing standard metrics on price, standard metrics on quality, and on best practices, so that we have apples-to-apples comparisons in healthcare on value, on where to go to buy things, how to stretch our dollar the best, how to buy the best quality services. Those, to me, are the key components of addressing the root cause of health inflation, of having an individual controlled system, and having the patient be the decision maker along with their doctor. For Medicaid, we say let's have the vouchers go to them as well, give the states the ability to supplement the value of those tax credits with their money in addition to setting up the high-risk pools. If a governor wants to block grant their money and try different reforms, they can do that as well. For Medicare, what we propose is turning the system into one not unlike what I have in Congress or federal employees have, where we have a payment that we use to select among a list of plans to purchase our benefit. That's what we propose for people under the age of 55 in Medicare, meaning for people who turned 65 in the year 2019, we gave them a fixed payment. It starts off at $9,500. It grows with inflation and health inflation. We adjust that payment in 3 ways. If you're high income, you're going to get a lower payment. We means test it. If you're low income, we'll give you a medical savings account and fill it up with money to protect you from your out-of-pocket cost exposure. And as your health condition deteriorates, you'll get additional assistance, so we risk adjust the payments. Focusing the Medicare payment, instead of going through this government monopoly right now, which has a $34 trillion unfunded liability, it's going bankrupt. Focusing the Medicare payment through the individual based on need, based on health need, based on income need, makes this program solvent. More to the point, the chief actuary of Medicare has looked at our plan and has scored it as achieving permanent solvency for the Medicare system. And so what we're proposing is basically a fundamental overhaul of our healthcare system. At the end of the day, what you achieve with this approach is universal access to affordable health insurance, but you do it in such a way that the cost is sustainable, we're attacking the root cause of healthcare inflation, and we're making our entitlement programs, the 2 biggest of the 3, Medicare and Medicaid, solvent and sustainable. My goal at the end of this, with the roadmap for America's future, are three things. Fulfill the mission of health and retirement security, lift this burden of debt off of the next generation, and make our economy competitive in the 21st century. I'll simply close with this. The current projections are this. By the time my three children, who are 3, 5, and 6 years old, are my age, they're going to have to pay twice the level of taxes. They'll have twice the size of government we have today just to keep this current government afloat. For the last 40 years, Washington has had to tax 18.3 cents out of every dollar just to pay for the federal government. That's the 40-year average. When my three kids are my age, 40 cents out of every dollar will have to go to the federal government just to keep these promises afloat, just to keep this current status quo afloat. That's no new programs, nothing. That's unsustainable. We can't win in the era of global competition if we're going to tax our people that way. We will go past Europe in embracing a stagnation model if we allow that to happen. And the biggest driver of this fiscal nightmare, this fiscal problem, in addition to demographics and the baby boomers, are healthcare costs. And so going down the road of single payer, of a socialized medicine system, of rationing is not the right way to go. I think an individual controlled, patient-centered system that is sustainable and affordable is the way to go, and that's what we're proposing to do. I think the next 5 to 10 years is going to decide. Probably the next 5 years we will decide. We're going to pick a path in this country. The current third-party payment system, totally unsustainable. It's imploding. We are either going to go toward the socialism model, the single-payer model, or the patient-centered, consumer-directed model. Obviously, I want to go toward the consumer-directed model. If we go to the socialism model, we will rue the day. It will be a problem, and then we're going to have to dig ourselves out of that hole, just like our friends in Europe are trying to dig themselves out of that hole. I'd rather learn from their mistakes, not repeat them, and go with the consumer-directed model. With the consumer-directed, patient-centered model, you can have a safety net. You can have a system where everybody has health insurance. You can have the compassionate system we have. And more importantly, you don't have to raise taxes and spend all this additional money to pay for that kind of a system like you would under a single-payer model. The left in Wisconsin are actually fairly honest about what it takes to have a single-payer model. The bill that the state Senate passed in Wisconsin this year, that but for the Republicans controlling the Assembly would have become the law of the land in Wisconsin, was to impose a new 15% payroll tax on top of the current 15% federal payroll tax to pay for a Wisconsin single-payer system. So in Wisconsin, had this become law, all workers would have 30% payroll tax on their wages just to pay for Wisconsin single-payer health care, Medicare, and Medicaid before paying any other tax at all. That's the kind of price you're going to pay if you go down to a single-payer model. But more to the point, you're going to have rationing, you're going to have you're going to have the market stunting innovation and all of those things. We should reject that model and go toward a consumer-directed, market-based model where we have extra assistance for people who are sick, for people with pre-existing condition, and for low-income people, so that everybody can actually get, good coverage for health care.